This is a video about how to perform a paediatric ECG. This is a skill that many of us perform on a regular basis but may not have had formal training. We have produced a one-page summary which will be attached to the ECG machine to help you with this. So the first thing to do is to plug in your ECG machine at the wall, turn it on, and then input your patient details. Do this first before attaching the leads so that the child or baby doesn't have to lie still for too long. So to do that, you want to press your power button here, press F1 which brings up your patient data, and then fill in each of these lines. Make sure you've got the right patient, check their details with the parent or guardian, and explain what you're going to do. Make sure you've got consent at this stage. Next, it's really important to position the child or baby correctly in a supine position on the bed or in the cot. Expose their chest, their ankles and their wrists, and then it's important to prep the skin. So to do this, we normally clean it with an alcohol wipe and then allow this to dry, and this will help the electrodes to stick properly. So here's an example of a wipe that you might want to use. Next, it's time to put on your electrodes. So we have 6 for the chest and 4 for the limbs. There are different sizes of electrodes. Sometimes you'll find there are these smaller ones, or else you might find the bigger ones on the ECG machine. If these ones are too big and overlapping on the chest, you can cut them in half lengthwise like this so that they don't overlap. So next you want to attach your leads. These are all labelled, either C1 to 6 for the chest, or there's various colours and letters for the leads for the limbs. It's really important that these are in the correct position to help you interpret the ECG later on. There's a diagram in this video as well to help you with the placement of the leads. The machine will normally be set to 25 millimeters per second with a voltage of 10 millimeters per millivolt. Sometimes you'll find that your QRS complexes are very high voltage, so you may find that the height of them overlaps, and this is really difficult to interpret. So if this is the case, you can change the voltage by pressing F4, and this brings up different options. If you change it to 5, this should then help the complexes not to overlap. It's really important if you've done this that you clearly document this on the ECG, because this will help with interpretation later on. So next, you're ready to record your ECG. In the top right of the screen, there's traffic lights, red, amber and green. Whenever this goes green, this means that you've got a good steady trace without much artifact. At this point, you want to press the ECG button, which is down here on the right, and then press that and then press print. And this will then print out a copy of your ECG out the side. Sometimes you might also like a rhythm strip, and the button for that is here. Once you're happy that you have a good trace, you can then remove your leads and your electrodes and yet let the child get dressed or redress the baby. Finally, you want to make sure that you've definitely got your patient details and a date and time on the top of your ECG. Once you've done this, you can then interpret it using the Paediatric ECG interpretation guide found on EOLAS. So the key points to remember are: make sure that you've got your patient details on your ECG. Make sure you prepare the skin with a wipe and let it dry so that the electrodes stick. Make sure that you've got your leads in the correct place, otherwise you won't be able to interpret your ECG correctly. If your QRS complexes are high voltage, then adjust the gain and document this on the ECG. And finally, whenever you finish printing out your ECG, use the Paediatric ECG interpretation guide found on EOLAS. Thank you for watching.